Hello friends, I am Dr. Anshuman Manaswi, Plastic and Reconstructive Surgeon at Bombay Hospital and Nanavati Hospital and Chief Surgeon at LaTransformatione, Reconstructive Surgery Center, Mumbai. Today we are here to discuss wounds. Welcome to the educational series. All of us have had wounds in our lives, sometimes small, sometimes devastating. Most of us know how to manage small wounds, but I would like to give you some plastic and reconstructive surgeons' perspective on that, and I would want to talk about deep wounds and how to go about them. Let's first come to small wounds. Most of the small wounds, because of small scratches or cuts, can heal by themselves. But any deep cut which is there needs stitching. Now, stitching are of various kinds depending on what is the skill of the person who is stitching. Here, a plastic surgeon is well trained to stitch your wounds so as to give you the best result as far as the scar appearance is concerned. And if this facility is there around you, it will be best to reach out to a plastic surgeon for the stitching of the wound. But remember, if a plastic surgeon is not available, then do reach out to the nearest doctor who is available, because sometimes the bleeding is too much, and in that case, the stitching requires to be done immediately. But at the same time, I would want to reinforce that the plastic surgeon's approach is entirely different, and always at the time of suturing or stitching, the surgeon always thinks as to how to make the wound look much, much better. We are especially trained for that, and that would be an advantage to you. Now, coming to deep wounds, chronic wounds. These are the deep acute wounds which I have already told you, that depending on the depth, you need to take a call. Often advised to consult a doctor as soon as you feel that anything is a little serious, a little deep. Chronic wounds have a lot of issues, and both the patients as well as the doctors are always trying something or the other to give a better wound healing. So in such case, a few factors determine how your wound will behave. One such factor is your nutritional status. A good nutritional status will improve your wound fast. So please take care of your diet. Pressure. Try and see that there is no pressure or as much less pressure as possible on the wound. That is again likely to heal the wound fast. Movement. If there is a wound on the joint, it is important that there is no movement of the joint or minimal movement of the joint till the wound heals. And the fourth thing, which is the adequate blood supply of that area where the wound is. And the fifth thing is whether there is an infection. Now the last 2 points require special consideration, and that is where a plastic surgeon comes into play. If the wound is dirty, there is infection, there is something called as debridement, which is a scientific word. But anybody with chronic wound would have heard this term. Debridement means a surgery, whether it is small or big, that depends on how big the wound is. But debridement essentially means a surgery to clean the debris. It has come from the word debris. To remove the debris is or necrotic tissue, the tissues with infection which do not have blood supply, means debridement. Recently, some non-surgical methods have also come in terms of ointments and all that, which can do enzymatic debridement, wherein non-surgically also the debris can be removed. But please be very, very careful when you are being suggested that, because enzymatic debridement have got limitation that they can be effective only when there is very less debris, very less infection, very less necrotic tissue. So in most of the cases, a surgical debridement is required, and please do not get afraid of that. Once the infection is taken off, then the second part comes is that of the closure. Now, if the wound is small, it can be stitched back, or it might just heal by itself. But if the wound is big, then there are various plastic surgical techniques which are used, wherein we borrow tissues from other places and make the wound heal. One such technique is a skin graft, but that is just one technique, and it is a very versatile kind of a surgery where a skin is taken from other part of your body like your thighs, and it is put on the wound after processing, and the wound heals because there is a skin cover. But remember, that skin which is taken is not the full skin, it is the upper layer of the skin, which means that it is just a papery thin kind of a layer which is put on the wound. That means that the wound should be really good. By good wound, I mean that it should look reddish. But there are limitations on the skin of the skin graft, because skin graft will not take up on a bare bone. They will not take up on nerve or vessels where they are exposed, and so many other places. So do consult in detail with the plastic surgeon as to how to go about it. The best way is to get a skin cover which is thick, as if like this. This is the thickness of the skin, and the skin layer is just a sort of upper layer. Okay, upper layer. Now, this kind of a skin comes with something called as flap, which cannot be just taken from somewhere else and put, because it requires blood supply. Then only it will survive. And those flaps can be of the adjoining area, can be taken from adjoining area. For example, if you have a small wound over here, I can take something from here and cover it without totally detaching it. That is a flap. But sometimes there are no tissues which are available, no skin surrounding skin is available. Then in that case, we have to take something called as a microvascular flap, which is taken from elsewhere along with a blood vessel and the arteries and the veins, and it is attached at the wound area, and the blood vessels are joined so as to give the blood supply to the borrowed thick skin, which is the complete skin. Sometimes muscles are also brought, sometimes bones are also brought along with that in that flap, which is called a free flap or a microvascular flap. And these are very, very advanced techniques, but they are used. So don't get surprised if the doctor gives you this option, the plastic surgeon gives you this option. You should also do some research, but understand that deep wounds, especially the chronic ones, are difficult to treat. And most of the chronic wounds, like in diabetes, have the issues of blood supply. When the blood supply of that particular portion, let's say heel or the toes, is very less because of the diabetic destruction of the blood vessels or compromise would be a better word. So in such a case, anything which we do locally may not just help. The key to such problems is a good flap cover wherein we get good healthy tissues from elsewhere and we put, whether that healthy tissue is from the adjoining tissue or from elsewhere, that will depend on the nature of the wound and the nature of the tissues around it. The idea of this video is to make you acquainted with some of the things which you might feel are really beyond your comprehension, and in such cases you should not get emotionally too disturbed or get your rationality away. At such time it is important that you read, consult your other family doctors, and most important is that trust your plastic surgeon, because the knowledge which a specialist has other people may not have. For example, science has developed too much. Now, a complicated neurosurgical procedure, even as a super specialist, but as a plastic surgeon, will not be able to tell you about that. Or your family doctor may not be able to tell you about that. Or a cardiologist will not be able to tell you, because things are changing very fast in the whole world. This is a very small world. We know because of the COVID crisis that it is a very small world. Something came in China and is all over the world. So, only the specialists of that particular specialty are best geared to address your problem. If required a second opinion, please take it from another plastic surgeon and then take a call. But in general, these are the techniques which are required for wound closure. Sometimes it takes months, sometimes it takes days. The sooner you reach to the correct doctor, the better will be your prognosis. Try and invest in that knowledge as to how you can reach the correct doctor. There are various digital platforms which are there which can connect you directly to a specialist. You can use them, you can Google, you can so many other things by which you can understand how to reach the specialist. So, the next series we will discuss in detail about other specific wounds like diabetic wounds, like trophic ulcers, like injuries to tendons and nerves, and so forth and so on. Wound is a very big subject, like bed sore. So, please be on a lookout for these kind of videos which will come to you very soon. Thank you so much.